what are the causes of teeth grinding? What results does it have on joints and the discs in your joint, etc.? There are many causes of tooth grinding. I think the ones that we see most often is bites that are not in sync, and that there are interferences in bite that your body recognizes and tries to correct those, tries to wear those things out by grinding the teeth and grinding away interferences in there. As a result of that, that causes often muscle problems. Those muscle problems can cause headaches. They can pull on the components of the joints and move the disc out of position. That is a pad between the top of the jaw joint where it articulates with the skull, so you don't have bone on bone. And sometimes that disc can get pulled out of position by the muscle activity, and you get clicks or pops in the joint. Sometimes there's a lot of pain because there are what's called retrodiscal tissues behind where the disc is, that as the disc is pulled out of position, those retrodiscal structures can get pulled into the articulating area between the condyle of the joint and the eminence of the skull, and they can get squished and squeezed and can be very painful. It's also been determined that there are some patients who are going to grind their teeth no matter what. Even if they had a perfect bite, they're clenchers and grinders. And in the past, it's been referred to as central nervous system grinding. It's just something that happens that people are going to do. Of late, there's been a lot of study of airway issues, upper airway restrictions. Dentists, ENTs are paying a lot of attention to those things right now, and we're determined that a lot of people who have sleep issues, who have sleep apnea issues, they have restrictions in their airway, and sometimes those restrictions are based on the anatomy in their mouth, especially if they have narrow arches, not a lot of space for their tongues, those kind of things. Mouth breathers, for instance, have a lot of issues with that. And there's a tendency, especially in sleep apnea people, to, as they stop breathing during the night and their body's survival instincts kick in, one of the things that can open up the airway is to grind the teeth as they open. And you can watch videos of people who are doing sleep tests, overnight tests, and you'll see that they're just completely silent. It's like they're dead. They're not breathing, and then all of a sudden their body will come alive, and you'll see this muscle activity in the jaw, you see grinding, and then as they're opening up the airway to get air in there. So there's a lot of study going on right now about tooth grinding. The things that we normally are working with are helping people to correct bite interferences that are causing tooth grinding. And then as we're doing dentistry, and we're doing especially restorative dentistry, we're paying a lot of attention to balancing the bite as we finish up our cases, and building in all of the guidance that is necessary for the front teeth to protect the back teeth, and to do everything that we can to avoid people developing a problem, or to continue to make them comfortable that they've had a problem and we've worked them through some process to get rid of that problem before we do the restorative dentistry.